Hello everyone, welcome to Sonogrip. Today we will talk about a complicated case which is Cesarean section scar niche. A 28 years old female lady presented with a complaint of fresh pervaginal bleeding which started immediately after DNC procedure performed 1 week ago. She has also two previous C-sections and recently she had a missed abortion which was diagnosed and managed by DNC 1 week ago. And now she complains about continuous PV bleeding since DNC procedure done. Let's move to the scan. What we got. The first thing we notice is bulky uterus and the endometrial thickness appears normal at that time. As we moved into the lower uterine segment, look at the endometrial cavity which is showing slightly gapping. This fluid or space within the cavity is our first clue for uterine drainage. Now let's zoom into the lower uterine segment. At the site of previous surgical scar, we see semicircular or triangular myometrial defect or niche. Also notice how the endometrium seems to tether or pull towards this triangle. This defect creates a reservoir where blood and mucus collect, often leading to patient symptoms of chronic spotting. In a post-DNC patients, we must rule out an arteriovenous malformation or retained products. So we apply color Doppler directly over the niche. As you can see, there is no internal vascularity. This tells us about the bleeding is not coming from vascular mass, but rather from the structural failure of the old scar site under the stress of recent DNC procedure. Let's summarize all the findings, what we write in ultrasound report for this case. Uterus is enlarged in size with slightly gapping in endometrial cavity, having normal endometrial thickness and homogeneous myometrium. There is semicircular and triangular myometrial defect and the tethering of endometrium seen in lower uterine segment at the region of old Cesarean scar. No adnexal pathology seen, no free fluid seen in pouch of Douglas. And for impression, we write Cesarean section scar niche. Key points to remember when reporting a niche, it is vital to measure the residual myometrial thickness for the amount of good muscle left, which is at least 2 mm due to tethering of endometrium. This helps the surgeon to decide on the next step where it is hormonal therapy or surgical repair. May you like the grip on this case. Thanks for watching. Please like the video and subscribe Sonogrip for more videos.